Joining us on your number one labor program from Africa to the rest of the world, the tripartite, the worker, employer, and government roundtable. I am Abulu Osemahu. Thank you. Do you want to know the next developing stages of permits to Canada? Now, Canada has released new workers' permit in some sectors. You would like to wait to listen to it in our global update on labor stories. We would also like to let you know that several months after workers in Nigerian Federal Capital Territory went on strike with protests and rallies, they have come to a conciliatory meeting. What did they resolve? We'll give you that later on in the program.
If you talk about former mining, the situation is not so bad as we have described it. But when you look at the South African situation, the Nigerian situation, all of that, they are informal mining.
Yes. In our Let's Talk segment, we're going to give you a gist of what is happening with African mining sector. How are the workers faring? Joel Odije Akato is the General Secretary of the International Trade Union Confederation, ITUC Africa, based in Lome. He's going to give us more light on the African mining vision.
According to current estimates, Africa is projected to face a shortage of 6.1 million health workers by the year 2030.
Oh yes, health workers, care workers, they jackpot every day in Nigeria and in Ghana and in most African countries. We'll give you a full gist of that communique read by the president of the Nigerian nurses at an event that held in Abuja.
Sense of disagreement, that's not far from it. For industrial peace, make sure that schools run normally from term to term, from semester to semester. Works, the same thing, electricity flow, every other thing normal. And such environment is good for business.
Hi, my name is Daniel Obeko, Regional Secretary for PSI Africa and Arab countries. Keep watching the Tripartite on AIT.
Welcome back. Now, let's take you around the world on global stories shaping the world of work.
According to the Economics Times, Canada has introduced priority processing for work permits in occupations deemed essential, including healthcare and agriculture roles, immigration, refugees, and Citizenship Canada, IRCC, said. The move aims to address persistent labor shortages in these sectors and speeds up employer-specific work permits such as LMIA-based permits, Francophone mobility work permits, and International Experience Canada permits. Occupations eligible for priority processing, healthcare roles on the priority list include registered nurses, nurse practitioners, general practitioners, medical laboratory technologists, pharmacists, and paramedical professionals. In agriculture and agri-food, eligible occupations include butchers, meat cutters, farm supervisors, livestock workers, harvesting laborers, and fish and seafood plant workers. Each role corresponds to a National Occupation Classification (NOC) code that must be accurately listed on the work permit application to qualify. How applicants can benefit IRCC's priority processing is triggered automatically when applicants submit an employer-specific work permit in an eligible occupation. Candidates must use the exact NOC code tied to their job offer or LMIA and ensure all documents, including job descriptions, are consistent. Open work permits, such as post-graduation work permits, are not eligible because they are not linked to a specific employer. Pathway to permanent. Residents, workers in these occupations may also have an advantage under express entry for permanent residents. Candidates with at least 6 months of experience in these roles can receive an invitation to apply ITA at lower comprehensive ranking system CRS scores. Most healthcare occupations on the priority list align with express entry categories, while only select agriculture roles, like retail butchers, are included. IRCC's new measures are introduced to reduce processing delays for workers filling critical gaps, supporting both the Canadian labour market and skilled immigration pathways.
Where are the people from Greifswald?
Public Services International, PSI, stood with workers striking across 22 university hospitals in Germany, demanding better frontline conditions, improved staffing and pay and more secure contracts. Sylvia Buller of Ver.di's Federal Executive Board said, "The states have announced that they want to cut spending on education. And we will not allow that to happen. Education needs investment, education is the future." PSI General Secretary Daniel Bertosser, who joined health and service staff from Rostock University, said, "Right now, health workers from PSI unions are striking across the world, and with many of the same core demands. From Rostock to Nigeria to New York, our struggle is global." After 3 years of sustained union struggle, members of the PSI Women's Committee in Chile have secured Senate approval for the Support and Care Law, an historic step toward building a national system of support and care. Their advocacy successfully placed care at the center of public debate, as a human right and core responsibility of the state. Sandra Lopez, member of the PSI Chile Women's Committee and Vice President for Women of the National Association of Fiscal Employees, ANEF, said that the approval of the law represents a historic breakthrough for public sector workers and for all women who have sustained care without recognition or rights. Naireth Quevedo, PSI Sub-Regional Secretary for the Southern Cone countries, said that this law marks a turning point in the way Chile recognizes care as a social right and a public responsibility.
In a statement released shortly after the conciliatory meeting between the FCT Minister Nyesom Wike and Labour Centre's leaders, in the instance of the chairman, Senate Committee on FCT, Mohamed Boumai, it was resolved that NLC, TUC, and the Joint Union Action Committee shelved their planned mega protest, initially billed for Tuesday, January 3. The statement, which was signed by the Secretary General of the TUC, Nuhu Toro, and the Acting General Secretary of NLC, Benson Upa, reports that all complaints of FCTA workers were addressed one after the other. The statement reported that FCT Minister Nyesom Wike agreed to mutual respect for the workers and sustained engagement. It was also resolved that as a result of the strike, no FCTA worker will be victimized. Another resolution reached was that all outstanding cases at the National Industrial Court to be withdrawn immediately. The meeting resolved that consequent upon agreements reached, all Joint Union Action Committee, NLC, and TUC affiliates are to resume work immediately, that is Tuesday, January 3, 2026. The NLC and TUC officials also instructed all workers to comply with the resumption directive and strike suspension order in the interest of peace and industrial harmony. The Joint Union Action Committee of the Federal Capital Territory Administration and the Federal Capital Development Authority in Abuja initiated an industrial strike in June 2025 and continued to protest into January 2026, demanding the resolution of several long-standing labor and welfare issues. Their core demands include payment of wage awards, promotion arrears, correction of salary distortions and payments, and restoration of overheads. Other demands are pension remittances, addressing tenure issues, which includes settling issues surrounding the prolonged tenure of directors, which has caused career stagnation for lower-level staff, and reversal of exam failures from a computer-based promotional exam, where only 22% reportedly pass.
My name is Mohammed Megardi Gadi, the Minister of Labor and Employment. You are watching the Tripartite program on AIT.
Welcome back. Now, as we told you in the opening, let's take you to Lomé, Togo, where we had an interaction with the General Secretary of the International Trade Union Confederation, ITUC Africa, Joel Odije, where he talked about the benefits or the protection for miners in the African mining vision, and also the benefits for countries that have mineral deposits.
Okay, first let's address the issue in context. We've been talking largely about informal mining and sometimes illegal mining and sometimes criminal mining. We've been having that. So let's put them in context. If you talk about formal mining, the situation is not so bad as we have described it. When you look at the South African situation, the Nigerian situation, all of that, they are informal mining. The Congolese one is a bit of a nuanced one, because which is what we're also experiencing every other places, including Nigeria, where you now have a cocktail of insecurity and illegal and criminal mining. And then you find out that bandits go to a community, mineral rich, chase out the people, occupy the place and start mining. Well, that the state should not allow. The state must live up to its responsibility to do that. In cases where illegal, informal artisanal mining is rifts, I also will not say there are need for artisanal mining. You might need them, but make the courage. It's difficult regulating artisanal, but it's not just to be imaginative. So we should regulate them and then put them into order. Some form of organization that the state just needs to organize is critical for that going forward. Don't forget, there are workers there. And if you want to do this with the trade unions. There are chances that you succeed better working with the union to properly regulate informal and regular mining. The situation of the Congo, which we said was clearly a case of insecurity that lay. You saw what we did. As ITUC Africa, we brought together the unions, even unions from Rwanda and the unions from Congo, to speak, to say, how do we as workers contribute to resolving this political situation? And don't forget, we are in the era of critical mining, the era of critical minerals, where there are minerals for renewable energies. And then if you have this mineral for renewable energy, a lot of countries will do anything to grab it. So this is where I will actually prescribe an African position. Africa really needs to come together. The AU has very good policies on all of these issues. The African Mining Vision, for instance, the critical mineral, the strategic green critical mineral policy, number of nice policies. They just need to agree. How do we harmonize together? A country like Congo, I can tell you, a country like Congo can generate energy that will take the whole of Africa. Are we ready to say, let's have a collective investment to support energy production and distribution from the Congo? If Congo has so many minerals, have we even thought about it? Sometimes people think this prescription that I'm offering are radical. They are not radical at all. Because what you have seen is that foreigners have been plundering the Congo for over 100 years. And why can't we come together where we have minerals as a continent under the African Mining Vision? Let's mine our own mineral. Let's work together, do value addition, build the necessary industry, achieve the necessary small, light-scale technology. If they are heavy one, you either buy them, you borrow them, or you partner with other developing economies and start something from the ground where the minerals are, and then you sell. Not this raw mineral that we are taking out for the cheap, our environment being depleted, and then it's even worse. People now want to take it by force, not wanting to pay, by encouraging bandits and criminals to come into these spaces. These are things we need to review together.
Now let's take you to Abuja, where the president of the Nurses and Midwives of Nigeria read a communique at an event on migration of health workers and care workforce organized by the Public Services International. At that meeting, a representative of the World Health Organization was also there, and he threw more light on the issue of Jakpaism. In Nigeria, it's called Jakpaism right now. That's migration. Let's enjoy it.
According to current estimates, Africa is projected to face a shortage of 6.1 million health workers by the year 2030. More than half of the global shortfalls of 11.1 million, with 85% of the African health workforce employed in the public health sector. There are several cases of African health and care workers who fall victim to sexual and gender abuse, exploitation in their destination countries due to fraudulence, unchecked foreign recruiters who exploit the unemployed of our skills and trained professionals seeking greener future. For our discussion and intervention, the public sector health employment must be prioritized given that 85% of African health workforce in public services. Migrant health workers encounter barriers to qualification recognition, fair treatment, and work permit. Monitoring marginalized group often face restricted access to training and career progression. Women-dominated nursing and midwifery practice, and they continue to face persistent gap discrimination, workplace violence, and unfair care burden that drive migration. Without genuine social dialogue and workers' representation, strategies to manage migration and address workforce shortage will fail. Health and care sector union must be central to decision-making on workforce policies, gender responsive and inclusive policies that ensure fair, safe working conditions and non-discrimination are essential to building a sustainable health workforce. We therefore call on African governments to urgently commit to the Abuja Declaration by allocating at least 50% of national budget to health. Implement living wages, increase staffing level, and ensure transparent pay structure to close wages gap, especially those affecting women in nursing and midwifery. Hard health sector privatization and outsourcing, which undermines the decent work. Invest in public health training institutions, continuous professional development, and clear career progression.
In our region, it's been estimated that by 2030, we're going to face a shortage of 6.1 million health workers in our region. And by the time you go to the point made by the comrade from Ghana, how we have 5% of the health workforce globally, but 25% of diseased body resides with us in Africa. So it's a paradox. We have the shortage, and in spite of that shortage, we are also the country, the region that is also losing a lot of health workers to countries that are doing much better and with less diseased body than us. And then we have very high migration rates. In fact, a paper I was looking at shows that about 1 in 10 of health workers produced in Africa are residing elsewhere. They're not residing in their own countries. We have the shortage, and we now have more issues around migration. And even to make it even worse, a study that was done by some colleagues showed that about 42% of health workers are planning to migrate. So they are even migration in process. They are still here, their body is here. but in their mind, their future aspiration is to migrate. About 42% are already thinking. Some are already taking steps to migrate in the next 2 years. So it's a big problem. And I'll talk more about one of the dialogues we had in Nigeria, and where we were talking about not just seeing migration as a problem. It's a big problem for us to achieve universal health coverage, especially if you consider the people who are living outside of Abuja, outside of Lagos, in Nigeria, for example, people who are living in rural areas who do not have access to quality health. And they die because of things that if that health worker could be there, they will be saved. Give example of skilled birth attendants, which is generally low in our country. If we have more midwives, more doctors, and other people, they'll be able to prevent this high maternal mortality that we have. And the professor already gave us the idea of the health worker population ratios, very low. And the rates we're going, we will not be able to achieve SDGs or even universal health coverage that we're looking at by 2030. A study by African CDC tried to put money to it, because this is, we also need to speak the language of our decision makers. We need to talk about money, not just for them, health workers are leaving. They will ask you, so we need to put money to it. African CDC estimated that African countries will be losing about $1.4 trillion by 2063. Just imagine how much we're already losing per year right now, and how much each country we're losing. Health workers are not just another set of health workers. They are an investment by the country. They are people who also help with wealth creation. People that are sick are not able to create wealth for the country. And we need to package our message to government in this way. So what are the things that we're doing right now? And the professor alluded to some of them, and to say that we're not short of policies. We have so many of them globally and also in our countries. It's the deliberate effort to ensure that those policies and global goods are being implemented and enforced that will really take us to where we need to get to. And I'll mention some of them. We have the WHO Global Code of Practice for ethical recruitment of health workers. All these countries across the world have signed on to this Global Code of Practice. And this is based on the WHO Health Workforce Support and Safeguard List. About 55 countries, due to the density of health workers they have, they will not be able to achieve SDG or universal health coverage. Do not actively recruit from these countries, these 55 countries. Most of these are in the sub-Saharan Africa, including Ghana, Nigeria, and so many countries. And the idea is so many of these countries have signed off to say we will not actively recruit. So that situation the professor mentioned in Sheraton is an aberration. It wasn't done by the government, but there are agencies they send, and we see them all the time. In fact, the way it is, if you are just an health worker, you will receive such an email in your, one time or the other. Work and earn big in Canada, in Saudi Arabia, you're being targeted. That should not happen. And the code of practice strongly discourages that. We also have the African Health Workforce Investment Charter. And the idea is to have a multi-sectoral intervention in training, in production, in deployment, in retention of health workers. We need to see health workers as our oil, as our mineral resources, to protect them, to invest in them, more remuneration, better service, condition of service for them.
Follow us on our socials, on Instagram, Facebook, on WhatsApp channel, and all the social media handles. Connect with us in our email address as displayed on the screen. We will be glad to do business with you. I remain your host, Abulu Osemahu.